Good morning, everyone. Welcome to the 9 o'clock class on mental health. I'm introducing Dr. Ernst, who is a clinical and forensic psychologist in private practice in Alameda and San Francisco. He is an assistant clinical professor in the UCSF Department of Psychiatry and a qualified medical examiner for the California Department of Industrial Relations. He routinely provides evaluations and expert testimony in legal classes involving capacity, psychological injury, and violence or suicide risk. Dr. Ernst.
Can everyone hear me okay? Okay. Thank you so much for the opportunity to present today. I'm really happy to be here. Been looking forward to this. And I wonder if this is on also. Is that better? I'm going to keep talking here. Tell me if it gets any better. It's getting a little better? Okay. Yeah, I hear like a weird reverberation too. I'm just going to keep talking here. I'll just start giving the presentation. I'm running out of like a watermelon rhubarb to say. So I particularly enjoy presenting to fiduciaries because I just think you're, and also associated professionals and attorneys in estate planning and so forth, because it's such a complex relational type of work that you all do. It really, as a mental health person, fascinates me in a lot of ways, the intersection between a lot of the legal work you do and the financial complications, but also what happens in the interpersonal matrix with the people that you serve. So I hope that this presentation can offer some different vantage points, some practical suggestions, and maybe some new ways of thinking that can support you in your work. This is a large group, but I think this is always a better presentation the more interactive it is. So we've got an hour and a half, and I'll make sure that I get through all the slides, but I would really appreciate it if there's comments that come up or questions or kind of case examples that you can give in an anonymous way, please jump in. Let me know what makes sense, what doesn't make sense. I'm very much parachuting into your field from the outside, so I would love your kind of guidance to make this as applicable as possible. Okay, so I'm going to speak about client control, which is this rubric term for keeping cases going reasonably well, preventing cases from going haywire, managing personalities with clients, managing the impacts of cognitive impairment with clients, family dynamics, what you get pulled into and how to manage that. So here's some problematic client control consequences. Time spent on non-billable client management tasks. I don't think anyone wants to be doing that. Increased distress and burnout. It's often not the functional aspects of your job that are the most difficult, it's these peripheral aspects that can cause so much burnout. Increased liability and poor case outcomes. So here's how I'm going to approach this. I want to first speak about challenging client personality dynamics. In psychiatry and psychology, there's been a lot of thinking about personality categorizations, different constellations of personality symptoms, and I want to try to explain that in hopefully as jargon-free and accessible a way as possible. It's useful to think about what type of personality you're interacting with, also what type of personality you have that you're bringing into the equation and how that can create difficulties or hopefully solutions as well. I want to speak about clients with cognitive impairment, which is relevant, I'm sure, to many of your, much of your work, and some of the complexities in identifying when cognitive impairment exists and how it may show up in cases in which it's not completely obvious. And then throughout this, I want to speak about screening considerations. Depending on your situation, you may have the pleasure of at times saying, this doesn't feel right, I see some red flags in this case and I'm just gonna decline on this one. Or you may be working in a situation where you don't have that luxury, and then at least my hope is that you can say, okay, this is gonna be a doozy. I'm gonna document everything clear, I'm gonna keep my ducks in a row, and I'm gonna be proactive because I see some potential problems that will occur. Okay, I wanna start with a potentially controversial thought to you guys, which is that that fiduciaries find themselves in an inherently parental role. What I don't mean, maybe it's not so controversial, I see some heads nodding. What I'm not saying is that clients come to meet you and say, I finally met the mother or the father that I always wanted. Hello, mom, hello, dad. It's a little more subtle than that. It's a little bit more unconscious. So what do fiduciaries represent? An authority who makes financial decisions that may have a great impact on client and beneficiaries' wishes and dreams. So an incredible amount of power that you hold in a way that intersects with an incredible amount of vulnerability in clients in terms of what matters most to them in life. And that is reminiscent of parental dynamics. An authority who is supposed to give you what you deserve, what you're owed, what belongs to you. You're kind of steeped deeply in early familial material, and I'll speak more about that over time, but I'm sure it's commonplace for someone to be working with you and bringing into that, I didn't get something important from my family, maybe not monetarily, maybe in terms of love, respect, connection, and now there's this monetary issue, and are you gonna give it to me or not? And are you being withholding, or are you on my side? And that brings up a lot of parental material. An authority who you must depend upon at a time of great stress frequently, and an authority who challenges fantasies about who owns the trust and an authority who can impact the rest of beneficiaries' lives. So the reason why this is important is because how we operate psychologically is much less rational and conscious than I think we would all like to think it is. We have different modes of seeing the world and relating to the world that get activated in different types of situations, and there's sort of an emotional framework that comes up. And I think an emotional framework around what it's like to relate to your parents emerges sometimes with fiduciaries. In a very commonplace way, you know, if I meet a police officer at a party, not working, I'm like, hey, Joe Schmo, let's have a talk, and it's not much of an experience for me. If a police officer pulls me over when I'm driving, I'm shocked at the level of sort of anxiety and fear and deference. I mean, this whole constellation occurs because they're in this incredible power position at that moment, and that brings up inside of me, if I look at it honestly, some sort of younger experience of being less powerful, being under the influence of someone else. Something similar to that happens, I think, with fiduciaries. There's a constellation of feelings that come up. And so it depends a lot what the history clients are coming in with. Whatever client's storyline is about authority and control, needing help, being protected, whatever their history is around that. When they really needed someone, were they there for them? When they were in danger, were they protected or were they pushed away? Those types of emotional experiences and expectations are going to show up in some form. And of course, the greater the parental conflict, the injury, the greater the havoc during childhood, the rockier road it's going to be. So sometimes people don't like this idea. I'd be curious, does anyone have thoughts? What fits about that? What doesn't fit about that? That fits everything. Well, thank you. Glad to hear I'm on point. Do we have a point of view from the opposition, how it doesn't fit? Yeah. Yeah.
But boy, initially, there's so many assumptions, and it is so easy to be wrong.
That's right. That's right. Yeah, the comment was, just to paraphrase it, that when you first meet, there's so much intensity, so many ways you're watching each other, so many assumptions that go back and forth, and over time you can make more sense of the meaning of that, but at first you just feel the intensity of it. And I think that makes sense. When you're walking into sort of an interpersonally dense, highly important situation, like meeting a new client, it is filled with material, if you're an intuitive person, You feel that on some level, and it takes a while to digest. What does that mean? And I think a process of listening to yourself, like, oh, I felt a little denigrated there. I can't quite point to why, but I felt a little put down, is important because there's information in there that can make sense down the road. Yeah?
I think it's kind of important to remind ourselves that even though this dynamic is happening, where we're kind of seen as a pseudo-parental, we have to try really hard not to be the parent, not to become part of the family dysfunction. And sometimes we do become part of it just by our own reactions, but just because that dynamic is there doesn't mean we have to buy into what they're looking for.
That's a great comment. So the comment was, just because there is this projection of feelings related to parents and family members, this pull to enter into different roles, doesn't mean that we need to walk right into that and play that out. And the internal boundary that you need to have is critical. I think my case would be the more conscious you are of what is being pulled out of you, what the wishes are of your clients, what the traps are, the more clear you can be in your position. It's when we're less aware of what's happening that we tend to enact things or get caught up in things that we don't want to get caught up in. So that's a great point. And I'm going to talk a little more explicitly about family dynamics and roles as we get a little further into this. Yeah.
One that strikes me as the parental thing is clients that I'm court assigned and they probably can't remove me, versus they named me in a trust and they can fire me. And that really affects that feeling of parental or not.
And does one make it feel more the case?
Well, the one where they can remove me, I mean, I feel like I need to keep, I need to keep them from firing me, but I need to do the best job I can within that reality.
Right.
The other one, I feel like I have a little more freedom to kind of try to set some boundaries or help them in that way.
That's right. That's right. Yeah, so the comment was about how it makes a big difference whether someone has the capacity to fire you, whether it's court mandated or not, and that has a different feel. I completely relate to that. There's a lot. Well, in some sense, they have more power when they can fire you, so they're in a more empowered position, and that just brings up a different constellation, depending who that person is. And when they're less empowered, that's going to bring up a different thing in you and them. So yeah, that's an interesting comment. I just realized I don't have a clock I can watch in here, so I'm going to turn on my phone real quickly so I can track it. So excuse me for a second. I have a watch, but I just saw that it broke. It's perfect. Wrong time for that to happen. Okay. Okay, so let me start moving on a little bit. Thank you for all these comments, by the way. I'm just glad to hear this is a group that is going to jump in like this. I think it'll make it a lot more interesting. I want to speak about personality styles. All individuals have one or more. So I'm not speaking here about personality disorders, which would be a diagnostic category implying some type of pathology or mental illness. I'm speaking about different categorizations of personality that we all have, and we all may have a few of them, to be honest. And I don't mean that in a pejorative way. It's that these are ways of organizing patterns of behavior, but they're not so discrete. They exist on a spectrum to different levels of intensity, and they overlap quite a bit deal, but it's useful to start to think about them. And what I mean by a personality is patterns of interpersonal behaviors. So what are the ways that we relate to people in a repeated way? Emotions, what are our primary emotional experiences? Are we shame-driven? Are we elation-driven? Are we prone to feel rejected and sad? Fears and vulnerabilities, what are our primary fears in interpersonal interactions and lives? What our fears are drive so much of our behavior. And defenses. All defenses mean is stuff that we do to get away from painful feelings. So like when I've had a stressful day at work and I go eat a donut instead of actually think about what happened, that's a defense. That's like a simple one. And then there's more complex defenses that happen as well. Okay, so I'm just going to start running through some of these personality styles. Paranoid personality. So these are individuals who have a pervasive suspiciousness and mistrust of others. That is just their filter of the world. It's dog eats dog. People are out there to get me. I don't trust any of you. I don't trust those smiles. I don't trust those comments. This is a hostile crowd. Projection of responsibility for failures. People who are paranoid, a way of understanding part of what causes paranoia is it's an inability to tolerate personal guilt and shame. You can't feel like you failed in any way because that's too psychologically threatening. So what you do to get rid of that is to project responsibility on the rest of the world. So using myself again, if I get a lot of terrible feedback from this presentation, I'm going to say, well, everyone knows fiduciaries don't know anything about psychology. I'm going to do anything I can to get rid of the feeling of, wow, maybe I missed the mark here. Maybe I need to do something differently. I feel a little bad about that. That sort of feeling inside is like kryptonite for people with paranoid personalities. Reading malicious intent into benign behaviors. You're having a meeting with someone, they check their cell phone. It doesn't occur to you that maybe they have a family matter they need to attend to. You go quickly to, they don't respect me, they're trying to get me off my game, they think I'm unimportant, so forth. So, does this sound familiar for some of your clients? Yes, okay. So screening considerations. If you're in a position to screen these clients, the question I would be asking is, can they form a basic trust in you? Because there's varying levels of paranoia, and we all have a little bit of it. And we all have a little bit of guardedness and constriction in the world. But it's, can this person trust me enough to do this job, or are we going to be in a dynamic where they are so mistrustful of me and so second-guessing everything I do that it's going to be a constant battle, push and pull, and it's going to be really non-functional. And what they need is the opposite of what they pull for. What they pull for is for you to kind of like pull away from them, protect yourself, put up more of a wall. And what they actually need is as much transparency as possible. And if you think about that, if you can kind of find inside yourself a paranoid moment when something happened to you and you were just locked into that experience of the world as dangerous, the less you know, the scarier that gets. If people are telling me what's happening inside of them, what their thoughts are, then that relaxes me a little bit. If they are completely removed, then I'm going to get more scared. So when I'm doing evaluations, if I'm evaluating someone who's more paranoid, I'm going to give them every detail about myself that I feel comfortable sharing with them, depending on what the context is. This is where I live, this is what I do, this is my family members. I sometimes even get a little neurotic in a certain way, just to be more human. Like, oh, sorry for being late, I can never get anywhere on time, you know, the car, the dog. Like, I sort of just show myself to be very human. I would never do this sort of professional, this is my role, you're not here to ask questions, I'm the one who's here to ask questions. That's just going to freak them out that much more. Here's the tough thing that they need is non-defensiveness and a willingness to accept more blame than is reasonable. No one likes to do that. I'm not saying that you have to, you know, completely acknowledge something that's not true, but when paranoid people are starting to blame you, which again is their mode of getting rid of feelings that they can't handle, feelings of their own shame, feelings of the mistakes that they've made that have gotten them into this situation, what you can't do is say, no, 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 that's not my fault, that's your fault. If you do that, that's just going to make them more paranoid. If you can find a bit of a middle ground of like, I'm not sure I see it exactly that way, but I don't know everything, so maybe I'm missing something, and I'll think about it, and maybe we can agree to disagree. Some sort of middle ground that's going to help them function a little better. Yeah, right. Yeah.
How do you, and then, of course, they broke down because they moved from LA to Santa Rosa. And so to help them through it, they just took off, to take their medicine. Okay. And she even got arrested for driving while morphine.
Okay.
How do you get it back? I mean, she's not local anymore.
Yeah. Tough question. So the question was, I mean, I've up till this point been kind of talking about people who don't necessarily have a diagnosis like schizophrenia, not like a psychotic level paranoia, but more just your run-of-the-mill paranoid person. But this can expand to psychosis, so let me kind of spend a moment there. I mean, first of all, I'm going to try to answer this question, but let me first start with an honest humility that, I've worked at a psychiatric hospital, inpatient with paranoid people, and I've had years of being unable to make a connection with someone who is deeply paranoid and unstable. So there is no magic trick. I have some things that might help a little bit, but it's very challenging when someone reaches a point of, truly misperceiving reality on a psychotic level. But let me think how to approach this. Part of what they're needing from you at that moment is a container. It's like they are flooded with feelings of terror and injury, and they need that absorbed rather than blocked. So I think the same principle applies with someone who is not psychotic, but on just sort of the normal paranoid spectrum, that you don't want to say, that's not true, I'm a nice person, I'm here to help you, you need to trust me. Like I had a colleague who was really good with paranoid people, and he would start a lot of sessions by saying, okay, so I understand I'm the worst psychologist you've ever met in your life. Where do we go from here? You would just completely absorb it. Or even a more extreme form, okay, so I'm working for the CIA. We got to meet for an hour, what should we do? So just totally take it on. That's sort of one principle, although, I mean, let me also say that was a therapist. I might not go quite that far, but that principle is important. And then, the second question, of course, is, so how do you get someone back on their medications when they're not taking their medications? And if you have a relationship and if they're enough in reality that you can have a conversation with them of costs and benefits, why don't you want to take it? What might be the advantages of it? That's great. And if not, if it's a lot of collateral work, often with family members, other people involved to try to get them on track. But it's a really hard situation. Yeah. 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 I mean, that sort of came out of my mouth, and I want to sort of correct that a little bit. I think that is a reasonable intervention in therapy because you're absorbing something and you're entering their fantasy and you're meeting them where they are and you can work from there. I actually do not recommend that intervention as a fiduciary, so I am correcting that. I'll be a little more careful. But yeah, you need to have your own boundaries and you need to stay in reality with them. But I think there's an emotional stance. I almost want to do it sort of like visually. One stance is like this, like I won't take that on. And another stance is like, okay, let me hear about this and let me understand it. What you literally say, I think it's reasonable to hold to reality, to say, I don't actually work for the CIA, I'm your fiduciary, I'm sorry you don't believe that right now. I'm not so convinced that what you say is going to make a big difference in what they tell everyone else, because they don't believe you work for the CIA because of what you say one way or another. And if you work for the CIA, if you think about it, and you're not telling them, why would they trust you one way or another anyway? I mean, that's just their worldview. But I hear what you're saying. It's important to have sort of some bearing, some grounding in your own reality. Yeah.
Going back to just the stylus issue rather
Yeah.
than disorder
Yeah.
spectrum, projection of responsibility for failure sounds like narcissism too. Is that played?
Yeah, I mean, I think narcissism and paranoia often, and it's kind of narcissism, paranoia, and antisocial features often come together in a constellation, so that's very related. Yeah. Okay, I'm going to move to the next one here. Schizoid. So this is actually not related to schizophrenia. It's an unfortunately named term, so just separate that out. What a schizoid individual is someone who's very detached from social relationships, but they're not detached from social relationships due to a fear of rejection or feeling not good enough, which is why most people detach. Instead, it's that emotional connection and relational contact is too overwhelming for these folks. So individuals who are schizoid have this wonderfully alive and at times overwhelming internal emotional experience. They can like sit under a tree and look at the leaves blow in the wind for like 3 hours, and they're just not bored at all because they have so many interesting thoughts and images and fantasies. Often it's artists or musicians. They have this very rich and sensitive internal life. The downside of that is that there's a part of them that gets overwhelmed very easily. It's also sort of like a highly sensitive person is another categorization that might fit into this. Too much of anything, visceral or emotional, can overwhelm them. Like I had a client who was schizoid who used to have this reaction to mayonnaise. It's like mayonnaise, like the guckiness, the sensation, like I can't look at it, it's so disgusting. It's like it just invaded this person who was also kind of a wonderfully thoughtful and reflective individual. So, you know, they lack desire for closeness, or maybe a better way of saying it is they only want so much closeness. They want a little bit, but not too much. The archetype of this is like the musician who makes, you know, the most beautiful romantic music, but can't actually be in a love affair himself or herself. That's just too much for them, but they have this tremendous amount of depth. So I actually don't think schizoid folks would be a huge issue in the fiduciary world. But if they're on the extreme end, a question I would ask yourself in terms of screening is, can they tolerate, excuse me, a prolonged interpersonal exchange with you? Can they handle being in the room with you for however long you need to meet with them and talking about some challenging things? And what they need is just as much space as possible. They don't need a hug every session. They don't even need a handshake. They probably need their chair a little further away. They just want as much room from you as possible. Okay, antisocial folks. A pattern of disregard for the rights of others. They just don't live by the same moral code that we live by. They may actually have a moral code, it's just not society's moral code. It might be a counterculture moral code. Limited remorse. When they hurt people, they just don't feel badly about it. They don't feel that guilt. It's just not there. And this, from my point of view, is not like a description of evil. I really consider this to be ultimately a neurobiological disorder. Antisocial is sort of a broader construct that can include lots of people. On the very extreme end of it, you use the term psychopathy. That's like, you know, way less than 1% of the population. But if you look at individuals who are psychopathic, and you do, you know, they do interesting brain scans now on them, there's actually different things happening in their brain in response to relational moments in other people, and parts of the brain that are associated with empathy and feeling others' feelings and taking in other emotional experiences just aren't online in the same way from quite early on. So I really do think this is brain dysfunction that ends up looking, you know, really nasty in many ways. Yeah? I mean, it might look like that, but I mean, these are folks who, I actually don't know if that's exactly what I'm describing. I think they would notice you and maybe try to get something out of you, but it's that they don't actually, it's not like, oh, I wonder what that feels like for me to step in front of line. It's like that doesn't occur to them or matter to them in any way. Well, the personality disorders came out of the literature on personality types, is the history of that. So, right, if you're familiar with the DSM-4, DSM-5, these are those categories, but those emerged from early kind of psychoanalytic thinking originally on personality. And I'm not actually going through the like diagnostic criteria. What I'm trying to do is get to what happens internally and psychologically in these different personalities, whereas the diagnoses are more behavioral, and I would say less helpful in that way. But yeah, yeah.
Do most of these personality types, do they develop, or is it a life trigger, or are they always that way from birth and it just comes out more, or is it, do we categorize it one way or the other?
Yeah, I mean, that's a great question. I don't know that I have a clear answer to that. I mean, what is clear is that people come into the world with temperaments and that those are powerful and various genetic predispositions Someone may be more thinking oriented, someone may be more emotionally oriented, someone may have more anxiety, someone may have less anxiety. People with antisocial organizations have less anxiety. And then that interacts with their life experiences. And I think to make it even a little more complicated, people's temperaments and genetic dispositions pull different things out of their parents and caregivers. For those of you who are parents, you may have had the experience, if you have different children, that something else is evoked from your child. So they're taking in a different you. Each of your children is to some degree. And then that kind of sets up different cycles in motion. So I think it's really both. And I don't think anyone can really parse it out more cleanly than that at this point. Yeah, I mean, I think the way you think about it is that people become more conscious of them and you get more footing outside of them. So if you've done a lot, if you start therapy being someone who's kind of narcissistic, meaning I need to always feel better than other people, I'm driven by shame, I need to prop myself up. Maybe someone starts a psychotherapy totally unconscious of that. They come in and say, well, I'm coming here because my wife and children sent me, I don't know what they're talking about. Hopefully, many years later, they would go into a party and they'd say, that person just kind of made fun of me and I'm feeling shameful right now. I think I just said something inflated, but maybe I don't want to go there, that's going to hurt that person. So it's just, the volume gets way reduced, but the core personality structure, in my experience, doesn't go away. That's kind of what we have for life, but it can look a lot different in different ways. Okay, so people who are more antisocial, screening considerations, can they be honest with you? Can these folks be, are they going to tell you the truth? Can they have a working relationship with you or not? And what they need is a practical, non-moralistic approach. People who are antisocial tend to be very impulsive, tend not to think through the consequences of things, and they need help thinking through consequences so they can be less impulsive, but not in a moralistic way. That's not right, what you're doing, but if you do A, I think that's going to lead to B, which is going to lead to C, which is going to lead to D, and are you sure you want D? And helping them think through in that kind of way. Okay, avoidant. This is like the corollary to schizoid folks. They also avoid social interactions, but not out of a feeling of interpersonal interactions being too much intensity for them, but out of a fear of rejection. They actually deeply hunger for connection with other people, but are afraid if I show myself, I'm going to be judged, I'm going to be inadequate. They start to feel really anxious. Often folks like this will get into a panic attack cycle. It goes something like, I'm walking into this party, I really want people to like me, I'm so afraid I'm going to look lame. Oh no, I just said something awkward. Oh no, I'm getting anxious, they're going to see that I'm anxious. Oh no, I'm starting to shake. Now I'm really going to look terrible. That makes them more anxious. Then they have more physical symptoms and it just sort of escalates to the point of a panic attack. It's this sort of interaction between self-critical thoughts, physiological symptoms, and then being afraid of the physiological symptoms. Feelings of inadequacy and a hypersensitivity to negative evaluation. I think for most people this is pretty easy to hook into. I mean, I think everyone has some small degree of social anxiety in this culture. It's such a performance-driven culture in so many ways that we are bred into that. And again, I think you're going to do okay with these people as a fiduciary. I don't think they'll be that difficult, but the screening consideration is, will they avoid interactions with you due to shame? When they feel bad about themselves, will they avoid you? And will you not be able to get connected to them? And what they need is just like love, like validation, praise, reassurance. I really like this about you. It's so nice to see you today, and so forth, just to make them feel like they're great just the way they are. Okay, narcissistic. People seem so much more interested in this recently. I have no idea why. Okay. An inflated sense of self with an underlying fragility and emotional emptiness. So people who are narcissistic just walk into the room like they own it, and they're very compelling. There's a reason why a lot of very successful people are narcissistic, and it's not all that bad to have a little narcissism. But it's like you walk into the room like you own it, You can kind of fill yourself up with good feeling about yourself, but what your whole personality is organized around is a deep sense inside of you, if you really sunk into it, of feeling unlovable, ashamed, not good enough, powerless, kicked to the curb. And that's what people with an extreme level of narcissism can't feel. They just can't go there. So their whole life has to be organized around being seen as good, and if someone doesn't see you as good, you need to annihilate them. Like they are dangerous to you, and you need to wipe them out. People are a means to reach your goals. So someone who's narcissistic, it's like they're living in this sort of, I'm on the road to glory. I'm going to be master of the universe eventually. And I really like you if you're a part of that picture. And as soon as you betray me, I've got nothing to do with you anymore. And I can't really tolerate your subjectivity in any way because I'm so consumed with mine. So, a narcissistic parent might have a reasonably okay relationship with their child as long as their child is physically attractive, going to Harvard, doing really well in life, because it is part of their, look at what a father I am, look at what a mother I am, look at how wonderful I am. But when their child disappoints them, or if their child were to need to expose some vulnerability to them, which of course they do, whether they're going to Harvard or not, they're struggling in different ways, then things go haywire, because that's a real threat to the narcissistic person's sense of self. And then if you're made to feel small and you're a narcissistic person, it activates an incredible rage. Like, you do not do that to me, I will make you small. And worse yet, just wait. I'm going to be nice to you for a while, and I won't forget. Okay, I'm giving you guys like the full extreme version of narcissism. I think the more everyday narcissism is like, sometimes I feel really kind of bad about myself, and actually it's really important for me to do well in my career because that makes me feel better about myself. And sometimes I'm so wrapped up in what I'm going through that I can't listen to my spouse or my friends or my children very well. And sometimes when I'm feeling ashamed, I do something to make myself feel better about myself. So I really want to kind of explain this as a spectrum where people are on different ends of it. And a little bit of narcissism is helpful because it's motivating. I mean, a lot of people in successful positions have a little bit of something to prove to themselves, and there's a drive in that that can be useful. And then I also would just say that I would say that all of us are narcissistically injured and have a little bit of this inside of us just in virtue of being raised in the West, and particularly in America. Like, this is, if you were to think about like a cultural disorder, like narcissism is like the all-American disorder. Yeah, like there you are. And how does that go? It's like I watch myself, I have 2 young girls, and I'll catch myself sometimes indoctrinating them into the culture of narcissism. Like, hey Mia, let's do a race to the side of the house and see who can win. And I'm gonna let her win, but I still like wonder, why am I introducing this idea of who's gonna win or not? Like, she's 3, so she's not operating there. Should have said that. She's really slow, I can always win. But like, why am I introducing this? So there's just a way that American culture sort of brings you into, there's a hierarchy, people are above, people are below, it's really important to do well, we're independent, our identity is based on who we are, let's not depend too much on other people, let's be self-reliant. I mean, a number of American values have a sort of thread of narcissism in it. There was this really, I found this very fascinating, I always mention this when I'm giving this talk, that the Dalai Lama, the spiritual leader of Tibet, does these meetings with neuroscientists and physicists and psychologists and all these different disciplines, these interdisciplinary meetings. And there was a conversation once where someone referenced the superego. The superego is the part of us that is kind of self-critical, keeping us aligned, telling us when we're doing things right or wrong. And he said, I don't know what that means. And the person was like, yeah, I know, I understand, that's a jargon term. I mean the judge, the part of us that's judgmental inside of us. And he was like, I'm not quite familiar with that. And then they said, the part of us that's self-critical. And there was like this half-hour conversation of trying to explain to him this phenomena that he totally didn't get, which is just fascinating. And I think that is because in Tibetan culture, there's a completely different collectivist framework where the self is not identified with us as separate from other people. Your value relates to the value of the community. I've hung out with Tibetans, they have plenty of their own stuff. I'm not trying to say like they're completely healthy and we're completely sick. This just isn't their thing. It's not in them. And this kind of like shame and feelings of inadequacy, which are like the bed and the bread and butter of most Westerners, like psychological struggles in life, just don't exist in the same way in some of these cultures. So we can all relate to this to some degree and hopefully keep it in check. Yeah?
You talk about national. There's a national conversation in the media going on about Trump
Yeah.
being a narcissist.
Yeah. Would I like to weigh in? Is that the question? What I've come to is to say, I've laid out a picture of narcissism, and you're free to make your own conclusions. And I remain nonpartisan during these presentations. Okay. Preoccupation, personality styles, obsessive compulsive. This would be like, obsessive compulsive would also be a little bit of an all-American disorder. You have to be a little obsessive compulsive to survive in America. I would guess that almost anyone who becomes a fiduciary has a little thread of obsessive compulsiveness, and I mean that as a compliment. What that means is you're organized, you like things neat, you like things clean, you need your ducks in a row. You just couldn't do your job if you didn't have a thread of this. So obsessive compulsive folks have a preoccupation with order. They like things organized. They can be a little perfectionistic. Where they get into a little trouble is they can tend to be a little ruminative in a certain kind of way, like can't quite make a decision, can't jump into things, end up sort of thinking, should I do this, should I do this, should I do this? Should I marry this person? What are the strengths? What are the weaknesses? It's been 10 years, we're still not married, like this back and forth kind of thing. And then a little bit of a compulsive need for action is what it can look like difficulty tolerating ambiguity and a need to keep doing things. And all of this is very productive on a lesser level. And America, American society is, I often just reflect on like, how do we all do it? It's like so complicated between just like taxes and trying to buy a house and doing this. I mean, there's just so much paperwork and bureaucracy to have to navigate by. You really need some of this to function in the US, but it can go a little bit overboard. So screening considerations. I think the biggest difficulty you run into with obsessive compulsive folks on an ordinary level, not like a level of mental illness, is can they tolerate ambiguity in a case? I assume that often at the beginning of a case, it's like you guys think in decision trees. And I know that's how I will often think. Like, there's like 10 decision trees here, and then we get on these 4, and these each have 3 decision trees, and you move down the line. You don't really know what the whole plan is from the start. And that can be very difficult to say to an obsessive compulsive person, I'm not quite sure yet, I need more information, or we need to wait, because they need action, and inaction is anxiety producing. And what you can give them is as much structure and clearly sequenced plans as possible. I mean, I might even draw out a diagram for certain obsessive folks. Like if we go down this road, here are these 2 options. If we go down this road, here are those 2 options. By next Tuesday, here are the steps that I'm going to take, and I'm going to email you before then to let you know that it's done. That's like a gift to them. Then they can just know this is handled. I don't need to manage all of this in my mind anymore. Any questions about obsessive compulsive folks? Yeah?
If you have a client that is, take this to a higher degree, or closer to autism,
Uh-huh.
what kind of needs would they have in that kind of situation? And what kind of screening?
Well, so autism the question is, if you take this to a higher level in autism, what would be their needs? And I don't have a ton of experience with autism, so I'm not an expert in that by any means, but my understanding of the obsessive compulsive behaviors is that they perform a different function to some degree. With a more ordinary person, with more ordinary obsessive compulsive features, it's around a lack of organization makes me anxious, and part of it is like feelings are overwhelming to me, so I tend to think a lot and do a lot of things to get away from feelings. Someone who's autistic, the way I was trained to think about it, is like that part of what they're dealing with psychologically is a lack of a sense of like a psychological skin, like they feel sort of like diffuse in the world. It's a little bit hard to describe, but you know, in more psychotic people with some autistic features, it could be like you can read my thoughts, or things from the TV can get inside of me, like a feeling of impermeability. So the sort of repeated action, like a head banging over and over again, or rocking over and over again, in addition to whatever sort of neurobiological function that is playing, which I'm sure there is, psychologically you can think about it as sort of that kind of rhythm organizes them and soothes them in a different kind of way.
What about just taking those features that you have here
Yeah.
and to a level higher? What changes in screening strategy in terms of how you manage it?
So are you talking about with someone with autism or okay. Well, someone with like an obsessive compulsive disorder would have various obsessions and compulsions. So those would be thoughts that they do over and over and over again, and behaviors they need to avoid different outcomes. So for instance, if I don't walk over this, if I step on this crack, I'm gonna get sick tonight. That's the obsession. The compulsion is they have to step on this track over and over again. And then it gets reinforced. What happens is they see the crack, they experience a lot of anxiety when they have the fear of stepping on it. And then when they step on it, their anxiety goes down temporarily, which teaches their brain to do this over and over and over again. So they get locked into a pattern. So I'm just trying to meander to thinking about how as a fiduciary you would help this. In therapy, you know, the treatment for this is exposure with relapse prevention, and that is about first teaching them stress reduction skills and then helping them tolerate the anxiety of not doing the obsession. As they do that, their brain learns that nothing catastrophic happens when they don't step on the crack. But first they have to get extremely anxious about it, and then slowly the anxiety reduces. As a fiduciary, you know, in addition to helping them get that treatment, which is something that really works, you want to support them in not avoiding things. People who are obsessive compulsive often are avoiding things that they're afraid of. Maybe I don't have a case, I mean, maybe I should have asked you for a case example, but if someone was like avoiding signing a document out of being obsessive compulsive or needing to sign the document tomorrow, both are different types of avoidance. They're either avoiding an anxiety or avoiding doing something that they're afraid of, and you want to try to help them be as non-avoidant as possible of what they're afraid of. And you're kind of using yourself to say, this is very anxiety producing for you, I'm in there with you, I think you'll be okay. Let's tolerate the anxiety of this. Let's count to 10. Give me a call tonight if you're feeling anxious. You're just trying to help them know that not doing what they feel compelled to do will be okay. Hopefully that's helpful. I'd be happy afterwards if you have a more specific example to get into that. Okay, this is the last one. Histrionic folks need to be in the center of attention, very dramatic, rapidly shifting expression of emotions. They're kind of all over the place emotionally, and considers relationships to be more intimate than they are. I don't know if you've had this experience of like sitting down with someone and 20 minutes in they say, you know, I've never told anyone this in my life. I'm about to tell you something. You're like, why? Why are you telling me? We don't know each other that well. So it's sort of this like rapid buildup of emotions. And the belief is if their needs aren't presented as a crisis, they won't be taken seriously. What this often comes from is folks who, as a child, didn't have their internal emotional experiences attended to and responded to by caregivers. Their ordinary emotional experiences, like I'm scared of going to school today, or I got a little hurt by what you said, or I feel sick. If that gets negated, then they learn that they have to create this external drama in order to be taken seriously. So part of what they need is to know that you take them seriously, and that they don't need all this drama. So when they're starting to sort of say, I don't know what's going to happen with this case, we're going to be in a lawsuit, my parents are going to do this is a disaster, and it's just like blowing up. What that pulls for is for you to say, whoa, 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 stop being dramatic, this is not so serious, everything's okay. And what they really need is, I get it. You're terrified about what's happening right now. I really get you. I'm with you, I take this seriously, tell me about your fears. So you're opening the door for them to share more about what's happening emotionally, but you, in the tone and the way you talk about it, are also regulating them. You're not being hysterical yourself. You're slowing down, you're talking more contained. Yeah?
I have a histrionic client, and she had to do a procedure yesterday. She wanted me to skip this conference so I could go to the procedure and hold her hand.
Right.
Yes, and she has a caretaker. I do like her overall
Right.
management. That is equally, she wanted both of us,
Yeah.
one and one at the end.
Yeah.
And my first thing was, I'm not going to miss my fiduciary
Yeah.
conference, but that's my specialty. So I called her before the procedure. I called her after the procedure.
Perfect.
Last night.
Perfect.
That kind of thing. But yeah, when you're talking to histrionic.
Yeah.
Yeah, I'd say
Yeah.
to my friend right here, I'm like, I got one right now that's wanting me to miss the conference.
But I mean, that's such a wonderful example of what I would hope that this presentation helps to do, and you're doing it on your own already, is like, okay, this is what this person is doing, this is their thing, I see what it evokes in me, that's fine. What it evokes in me is like, screw you, I have needs too. I'm going to this conference, it only happens once a year. Yeah. But then you think about that, you don't act on it, and then you come up with a reasonable plan. That's great. Yeah.
Is it ever present like in a more serious or higher level in people lying about like being ill or that like over dramatizing their life with lies?
Yeah, I think it does. I think, I'm sure some people sometimes lie about being ill. I think often they sort of trick themselves into believing they're ill in this complex way, which makes it hard because you can't say, I don't think you're ill. That'll never work. But you also can't believe them. So you got to find some sort of road other than that. But it's something like, I'm really ill and I'm alone and no one cares about me and I'm going to get so much sicker because I'm all here alone and actually I'm feeling sicker right now, and kind of this emotional experience and whatever low-grade medical experience they're having gets combined, and then they start to interpret emotional symptoms like low energy, like not being motivated, like maybe physical symptoms of anxiety as signs of an illness, and it kind of catapults from there. I mean, that sort of histrionic component could be like diagnostically superimposed upon like a psychosomatic disorder, like a pain disorder. It's a similar dynamic that emerges. Okay, I'm going to keep on going here. Okay, I want to try to simplify this a little bit since there's so many personality styles and talk about traits cutting across personality styles which affect interactions. If I was to boil this down to like two major categories, it's people who are excessively independent and people who are excessively dependent. I mean, that's one useful rubric to hold in your mind. So I'm going to spend some time talking about the excessively independent client. The thought system is, I can only depend upon myself, nobody is as competent as me, nobody has my back, and others will harm me if I let them. So like, I'm in life alone, I need to manage everything on my own. There might be some nice people that I interact with, but at the end of the day, I gotta take care of myself. So it's the opposite of a worldview of, how we all function in life is by depending on each other in a healthy way. It's like the opposite of that. Potential causes: early rejection of emotional experience leading to a self-reliant survival strategy. So if your internal emotional experience gets rejected when you're a child and you're attempting to reach out to others, which all children intrinsically do, then you learn very quickly that your survival strategy is to manage everything emotionally, because trying to reach out to others gets associated with disconnection. So I wanted to just veer off for a second and talk about these strange situations, infant mother studies that I just found fascinating. These started in the 70s, 80s, I believe, and it's part of, it was kind of the bedrock of attachment theory, which has become kind of a bedrock of psychology and development. So these were done on mothers and either, kind of young children, like toddler-age children. Fathers weren't involved because of gender issues at that time. Now there's more fathers involved, but I'm just going to speak about it in terms of mothers and children because that's what the research was. So what the structure was is a mother brought her child to this playroom, which was in this laboratory, in this science laboratory. And they play together for a little while, and then the mother is instructed to suddenly leave the room without giving the child an explanation and leave the child alone in the room for like 2 minutes, which is totally stressful, right? Like you brought your child to this new experience, they're just getting to know it, they're playing with their mom, they're having fun probably, and then their mom's gone. I think it's varied, but the videos I've seen are like toddler age, yeah. And then what the study is what does the child do when the child returns? Sorry, what does the child do when the mother returns? And there's some interesting findings. So I'll see if you guys can guess this. Some of it is counterintuitive for some people. So for children who are what could be called securely attached, what that means is that they have a relationship with their caregiver where when they're in need, they can reach out to them, they can seek proximity from them, they can say, I'm so scared, Mom, I'm so hurt, I need you, and their mother responds appropriately, not hysterically, but appropriately, like, I see you're hurt, everything's okay, I didn't mean to hurt you, maybe they give a hug, the child moves on, and that forms a certain kind of connection. For those children, what do you predict they do when the mother returns? All right, I'm hearing a lot. Do you want to raise hands? I can't quite make them out. They run to her? Okay. What do other people think? Yeah, they might be angry. Yeah. Both are actually true. They'll run to her and then they get angry. And they say, you know, in a toddler version, what just happened there? I'm really angry at you. You just left me. They don't say it in this language, but what they're really communicating is, hey, I really need you. I rely upon you to survive, and you just bailed on me without any explanation, and I'm really angry because that scared the hell out of me. And then the mother says, I'm sorry, everything's okay, gives him a hug, and then what happens? Go back to play, right. That's the important thing. Minute later, they're safe, the world is safe again. If you were to measure what's happening physiologically, they're no longer in a fight or flight response, they calm down, and they go back to life. So, same thing happens with a child who has a rejecting parent. So this is a child who, when they say, Mommy, Daddy, I'm scared, they get some message like, I don't want to be bothered with that, or don't you show me that, or that's weakness. And I don't want to make this too simple. The best of parents at times set limits with their kids' emotional experiences, and that's helpful to kids. So I'm really talking about an extreme, repeated pattern of parents rejecting their children's emotional experience. And the children learning that when I show my feelings and my vulnerability to my mom, what I get is punished or rejected or ignored. So then those kids are in the situation, the mom leaves, the mom comes back, how do they respond? That's right, they ignore. They don't show anything. If you were to measure what's happening physiologically, their anxiety is extremely high. If you were to look at them, they look completely flat. Fast forward like 30 years and you find this, I'll say it's a male in couples therapy, and here's what you see. You see his husband or his wife saying, I feel like you don't care about me. I look at you, you're robotic. I mean, these are kind of extreme statements, but you don't have any feeling inside of you. And if the therapy goes well and this person starts opening up, they're actually feeling a tremendous amount of anxiety when they're around their partner. They're terribly afraid of disappointing them. They believe that if they show who they are, they'll look weak and less attractive. And what they've learned is, because I need to keep this person and I love them so much, I have to clamp down all my feelings, because if I show them, I learned very early on that that leads to rejection. And that's not conscious, is the thing. That's what's happening beneath the surface. And here their partner is feeling like, he's ignoring me. I open up to him and he starts looking at his phone. He couldn't care less, and it's just the opposite. It's that's so scary when that contact happens. Okay, so that was a bit of a divergence, but I wanted to just kind of bring that into the excessively independent client. This might be who's walking inside your room. They learned very early on they need to manage everything on their own. Here they're meeting a fiduciary. You have incredible power in their life. They need you very much. And what their internal emotional message is I can only rely upon myself. I can't trust you. If I trust you too much, you're going to do me wrong. Some other factors that can lead to a lot of independence is early trauma. If you're frankly traumatized, physically or sexually abused, or neglected, which is another form of trauma, that can kind of lead to a pervasive hypervigilance of the world. Everything is dangerous. And feelings of shame and inadequacy defended against by self-inflation. This is like the narcissistic version of this. I feel so poor about myself at the end of the day that I need to inflate myself to get away from those feelings. And because I'm inflating myself, I need to be in charge of everything because I can't possibly let you have something that I don't have. That would be threatening. Behaviors, they need to be in charge of tasks, even when they don't fully understand them. High anxiety, if required to let the fiduciary take the lead. Constant push and pull, interrupting a lot of the time. Feeling humiliated by fiduciaries, perceived superior power, status, resulting in the need to criticize the fiduciary. Maybe they need to put you down so that they don't feel so below you. Here's an excessively independent client at Hell's Gate. His wife says, "Now will you ask for directions?" Okay, I want to speak a little bit about cycles of interaction because it's a lot more complex than just a client having a personality. It's that a client has a personality, you have a personality, and then there's a cycle of interaction that emerges between the two of you. So here's what a cycle of interaction is, as I understand it. Being pulled into a destructive and repeated pattern of interaction which is self-reinforcing and mutually distressing. So it's like a cycle that happens over and over and over again. I had a family therapy supervisor, I always mention this in this talk, who, when I was first training in family therapy, I said to him in supervision, I just feel like I missed what the cycle was in this family. And he said, don't worry, they're going to do it 1,000 more times. Just hang out. So over and over and over. Okay. External statements and behaviors are a response to undisclosed, distressing internal feelings. This is the, I think, more complicated part to get about this. The conversation is not actually about the content of the words much of the time. Someone is having an internal feeling, they're not sharing it, and they're doing something with that feeling. And that's what you're seeing, is their response to that feeling. So for instance, someone is feeling scared of letting you take charge, because that's how they function in the world, by doing things themselves because they believe they'll be injured if they don't. They're not going to say to you, excuse me, can we just stop for a minute? I know you're giving me some advice. I want to let you know I'm feeling very scared because I learned early on that I can't trust people and I'm afraid you're going to injure me. They're not going to do that, and maybe they won't even consciously process that experience. What they're going to do is interrupt you, put you down, say, I don't know about that idea. I think that's a bad idea. And it may have absolutely nothing to do with the idea. It may have a lot to do with the idea. I'm not saying that you guys couldn't have an idea that someone disagrees with, but I would consider that some of the time it's actually not about the content of what's being said. This can coexist between two individuals or within an entire family. And how do we know we're hooked in one of these cycles? An urgency to make a point. If I feel like I really have to speak, that's a sign that I'm in one. Emotional escalation, when you feel suddenly panicked, not warranted by the content, or when people shut down or engage. Those are all signs that you're kind of hooked into this like vortex. I'm pulled into this thing that I'm doing. And I find the easiest way to tap into this is in our romantic relationships or friendships, where it's just like, I can't believe we're having the same fight over again. Like we're talking about something different, but it's like, here we go, and I know what I need to tell you now, and it's like hard to believe that you've been saying the same thing for 20 years and it's never worked, but you're going to keep going there. It's that sort of getting pulled into it, which we all do. Here's some cycles of interaction. Classic pursue, withdraw. One turtle is saying, come out of there, Harry. We're not done talking. Harry gets further in his shell. Harry's partner starts to poke at him more. And then here's an attack. If you want to save your marriage, tell each other you're sorry. And they both say, you're sorry. Can agree on that. Okay. Getting hooked with an excessively independent client. It goes something like this. The independent client communicates to the fiduciary, you're not good enough to trust, you're inadequate, I don't need you. Not in those words, but that's the message they're giving you. How does the fiduciary respond to that? they get anxious. You guys are in this, I think it's helping people who get into this profession. You want to do a good job. Someone's giving you a message you're not doing a good job, and that's anxiety provoking. Maybe less so as you get experience, but I would imagine there's always a little bit about it. You get anxious about the case outcome, you feel disrespected, you feel a little insecure. What would fiduciaries do to deal with those feelings? Again, they don't say, I'm feeling a little insecure right now because you're making me feel less than. Not that you should, but you don't communicate that. Instead, you emphasize your expertise, you emphasize your role, you communicate that the client should just trust you. You sort of say, don't put me down, I'm going to stand up for myself. Totally human response. I'm not saying there's anything wrong with that necessarily, but what does it do? The independent client feels more inadequate, more disrespected, more anxious. It's like they needed to put you down, you needed to say, no, 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 I'm up here, and then that makes them redouble their efforts. And then that just sort of is a cycle that can just flow from there and on. Okay, so how can we get out of this a little bit? So there's the push-withdraw Aikido move. That is basically, if you need to assert a little pressure on someone who's independent, try it out. Just give them a little like, this is what I think you should do, or I think you're messing up right here, and then study their response. That's the most important thing. If they get more defensive at that moment, then back off a little bit, and maybe you're going to come back to it a minute later, but don't start barreling. If they are receptive and open up, then you're on the right track. Give them multiple choices, all of which you can live with. If it's possible, give them a couple choices, both of which are reasonable, so they feel like they have more power and more control. Emphasize their competence to increase their self-esteem, so the opposite of kind of putting them down, building them up, so they feel less of a need to act in this way. And then emotions is destabilizing for these folks, so you want to keep the emotional temperature as low as possible. I'm going to skip that slide. I'm going to skip a few slides here because we got a little bit behind. Screening for excessively independent clients. Here's some things I might consider doing if you have a sense. When you're meeting new clients, I would trust your feelings. There was someone who made a really nice comment, I can't remember exactly who, maybe it was you in the blue scarf, about how you feel so much in the first meeting and you don't quite know what to make of all of it yet. You couldn't possibly know how to make meaning of all of the feelings that you're having, but they're meaningful. So I would trust them. So if you're having a little bit of a whiff of something doesn't feel right here, and maybe this is a person who kind of falls into this constellation, you could run some little tests. You could see if a client can follow your directions and allow you to lead. If you're doing a preliminary consultation, there's not a commitment to work yet, say, okay, here's what I'd like you to do, and just see what happens. Study that. Is there a history of experiences with incompetent people? If you're hearing about like the last 10 incompetent fiduciaries, like, get ready to be number 11. Is there excessive anger or paranoia directed at another party? If they're in this mindset of someone else is bad and terrible and against me, I mean, litigation and deaths and trusts pull for that out of all of us. So I don't want to make more of this than there is. But if it's a really extreme version of that, that's sort of a sign of this type of personality organization of being very independent. Are there subtle criticisms or passive-aggressive communication? And then an interesting thing to do is explain the law as it relates to a case, as it relates to their case, and test if they understood it. To say, here, I just want to teach you a little bit about something. And then at the end of it, say, I'm not always a clear communicator, and sometimes I use jargon because I'm in this field so much. Can you just tell me what you heard so I have a sense of whether you're understanding me? And then see if they can repeat it back to you. I mean, that's really illuminating how much of the time people do not understand what you're saying. It's just across the board, it's an illuminating thing to do. But with someone like this, see if they can understand it. And then if they can't understand it, then there's a bit of a differential. Is there a cognitive issue going on? Can they not learn? Or is it more that psychologically they can't allow themselves to learn, as opposed to because of memory or concentration issues, because that makes them feel too one down? Okay, I'm going to move on to the excessively dependent client. Complete opposite of the spectrum. I can only exist by staying connected to a powerful, benevolent others. So I only am safe in this world when I'm completely connected to someone who I really value. I can't become competent because this is a threat to my relationship with those I need. Sometimes these folks will have had a parent who couldn't allow them to separate or individuate because of how painful it is. And that's a pretty natural thing for parents. It's like you want your kids to launch and move forward, but it's very sad for them to depend on you less in life, because it's also so gratifying for them to be like your little baby. Others are completely powerful and competent, and I am lacking. So kind of a lack of self-esteem and an idealization of others. Here's the tricky part, the movement from idealization to devaluation that can happen. When a powerful other fails me, there's an eclipse of all that is good in him or her, and I discover that he or she is terrible. So this movement from you are so wonderful, you are so great, to not, oh, you're not quite as great as I thought you were, but you're still okay. It's not that. It's, you were horrible and I've discovered who you always were, and you've been fooling me this whole time. It's this complete switch. Potential causes: too much trauma and too little safety in childhood to develop the ability to see people as having good and disappointing parts. It's a psychological development to reach a point where you can say, people I'm connected to in my life have good intentions and good parts, and also let me down at times and have some destructive parts. I mean, we all, in my point of view, have, you know, positive parts and destructive parts inside of us. When you have a little kid, their sort of emotional reality is their parent is either godly and wonderful and the most incredible person in the world, or just horrible. And I have like a 1.5-year-old and a 3.5-year-old, so I'm like deep in this. Like, I am the most amazing father, and then like 2 minutes later they have to take a bath, and I am horrible. Like the worst person in the world. We hope that as our children get older, they can reach a point of, ugh, Dad wants me to take a bath again, this is so annoying, but I know he loves me. You know, something like that they can hold into both sides. If there is too much trauma in an environment, that doesn't really happen. And the world gets filled with like angels and demons. And there's people who get very organized in that way. Narcissism can look like this. I mean, a lot of these things overlap. That narcissistic component of people are with me or they're against me has this flavor and can come from some of this. Can also come from a lack of a parental figure. Oh, I said that already. Overwhelming loss leading to hunger for emotional closeness. People who've had a lot of loss in childhood can have so much hunger for the parent they've never had and really need someone there in a way that's idealizing and kind of age inappropriate. Excessively dependent client. She says, I'm not dependent on you, I'm like this with everyone. Okay, here's how you can get hooked with an excessively dependent client. The client idealizes the fiduciary as a strategy to stay connected. Everything works out great at first. You're this amazing fiduciary. Fiduciary gets caught in the idealization, believing that she and the client have a special relationship against a horrible other. The fiduciary overdoes for the client rather than insisting on her competence. You get caught in being wonderful, feeling wonderful. It infuses you with good feelings, and you start overdoing. Client becomes progressively less competent. Suddenly, you make a mistake, or the client perceives you make a mistake. Client discovers that you are actually completely horrible. This is very confusing if you guys have been through this experience, because it's not like you believed them. You were like, we were doing something really great here. I was committed to you. We were flowing. We were getting something done. And now I'm the enemy? I mean, it's just totally disorganizing psychologically. So how do we respond? Primarily what humans do at those moments is they either withdraw or they criticize. We're overwhelmed. We're either going to put the client down or we're going to shut down and withdraw. Either way, it is going to cause the client to become more erratic. So what can we do to try to avoid this? And it's not entirely easy to avoid. Believe in clients' ability to act competently and don't get hooked in overdoing for them. I try to listen to, like, if I'm doing an evaluation and someone says, you know, I'm trying to go to Barney's in Berkeley. Do you know how to get there? And I find myself looking on the phone, like GPS for the client's directions. And then at some point I think to myself, wait, you have an iPhone? Like, you don't know how to use Google Maps? Like, you just get caught into overdoing. So I try to notice when that's happening. Highlight and reinforce their success. Really articulate the limitations of what you can do over and over again. You want to stay on as level ground as possible. When they go into evaluation, go slowly, not quickly. At these hot moments, the tendency is always to charge forward into action in one way or another. That's what we all do when we're anxious. And you really want to slow down at those moments. And to some degree, emotionally process inside of yourself and tolerate the message of, you've totally failed me. I'm not saying you have to believe it, but absorb it for a moment. Stay internally in touch with your competence and think about it psychologically, that this isn't just about the nuts and bolts of what we're doing. Something psychological is happening in this client and between us. Know your ethical, legal boundaries. And then I think the strategy that I most emphasize is you want to help your client hold opposites together and get out of black and white thinking. So your client is saying, you failed, I'm angry at you, I can't work with you. You're saying in your own language, I know you're angry, I know you're scared, but we're in a critical situation here and we have to move forward. How can we do it? It's like, don't equate their disappointment in you with them needing to get away from you. Yeah?
So you've had that conversation with the client many, many times to kind of stay on track with what the goals are as far as, you know, getting them set up so they have better conditions, and they still are well, they just won't change their mind at all. They're still calling you horrible, and you know, you're the worst fiduciary in the world, and I can't trust you. What then?
I mean, a part of it is just accepting that's the state of affairs. You're going to be, I mean, I need to know more about the case to get more specific than this, but from what you're telling me, this client needs to see you as horrible. So I would think about, is there anything I'm doing, not in terms of being a poor fiduciary, but is there anything I'm doing in the interaction that is contributing to this? And secondly, if this is their psychological stuff, then it's like, okay, how do we work together despite the fact that I'm a terrible fiduciary in this person's mind? And I'm not saying, say you're a terrible fiduciary, but there's a degree, I guess what I'm saying is, our resistance to that state of affairs worsens that state of affairs. And the more that we can accept it, things soften just a little bit. I'd be happy afterwards if you have a more specific case. Yeah?
I was just going to suggest I've had a few cases where I was very aggressive, and one of them in particular, just like within 6 months decided I was evil.
Yeah.
And very angry when he would see me. And so I ended up hiring a care manager or someone else to be more the person who would visit, and I would do the things behind the scenes.
That's great.
Didn't want to create that kind of environment.
That's a great comment. Yeah. Bringing some people in, you do it more behind the scenes. Often just a reset to a new person is very useful. Not because that person is necessarily better than you, but it's because they're not burdened with this projection. Probably in 9 months they'll be burdened with this projection, but there's some time. It's really actually very useful. Yeah.
In situations like that, what I have found too is to get a consent to release information from the client. So if that third party is there, that you can talk to the third party too. And that's been really important, especially with confidentiality and anonymity.
You know, that's a great comment. Yeah. Getting a release, being able to communicate. I mean, in a sort of hospital setting, these kind of clients you would work with in a team format with the goal of you're all going to hold different parts of their experience. One of the therapists is going to be the devalued therapist. Maybe the psychiatrist is going to be the idealized. And if it's a functioning team, they don't actually get identified with those roles. Like, I'm actually doing a better job than you are, or you're not understanding that client. You see it as different parts of the self. So that's very containing, the way you guys are talking about applying that within fiduciary practice, of having different parties and the one not holding a certain projection can do more of the interactions with the client. I think that's a great strategy.
And the client can sign that too, and they feel safe.
Absolutely. That's great. That's great. Okay, screening for excessively dependent clients. Is the client idealizing you before she knows you, projecting a more successful case outcome? Is there a history of being betrayed by people they thought were trustworthy? Basically, is there a pattern of this? Okay, I want to speak about families a little bit, since you guys are just, yeah, you guys have a very interesting and challenging job as I work with fiduciaries more. I mean this genuinely, really respect the work you do. Homeostasis. So families have roles, patterns of communication, and alliances that tend to remain the same and return to homeostasis. They do the same thing over and over and over again. There's different subsystems that have different types of alignments. There can be an alignment between the parents. There can be an alignment between one parent and one child, between a grandchild and a grandparent. Some people are connected, some people are disconnected. The behavior of one person sets off a repeated sequence of interaction between family members. Mom gets freaked out that the trust process is not moving as quickly as it needs to go. Dad gets overwhelmed by mom's feelings because he hears that she's telling him he's failing in some way, and he copes with that by withdrawing. The son gets pissed at dad because it reminds the son of the way that the dad wasn't totally present with him, and comes after the dad while supporting the mom, and the mom and the son get aligned. The sister feels like she's the only one who understands dad and starts fighting with brother and mother about son. I'm just making that out of thin air, but it's like this ping pong goes on over and over and over again. New individuals, i.e. all of you, are inducted into the family pattern of interactions. They pull for you to enter in one way or another. Money or inheritance becomes a proxy for love, activating early attachment needs related to closeness, acceptance, appreciation, and feelings of rejection. I mean, money is not just about money. I'm sure this is too obvious to you guys to even say. But when someone's not getting enough, they're not getting enough maybe of what they need financially, but I can bet that they also felt that they weren't loved enough in some way. There goes my sibling getting more. He was always loved more. Finally, someone is going to see how screwed I get in this family. I mean, it's so multi-layered. And then families with rigid patterns can't respond adaptively to changes, such as death or decline of a family member. For instance, if you have a family system where the father is seen as the highly competent one, the mother gets identified as the incompetent one. Not necessarily because she's incompetent, actually maybe that's what works psychologically for the father, and the kids got co-opted in that. What happens then if the father dies? Totally rigid system, there's no way that it can function. If you have a more fluid system where both individuals have competence, they kind of tag team at times, the children are brought into competence as they get older, then people are going to be able to step in and form a new organization. But the more rigid things were before an event like a death happens, the more stuck they get afterwards. So what kind of roles can fiduciaries be indoctrinated into? The rescuer. Finally, you're going to rescue me from these people who have traumatized me for so many years. I'm so glad to meet you finally. Protector. In the middle of these moments when I'm being denigrated, you're finally going to step in. Maybe unconsciously, mom never stepped in when my dad was abusive to me. And I'm so hurt by dad, but I'm also so angry at mom for not protecting me. Now I've finally found someone who's going to protect me, and wow, am I going to be angry if you don't do that in the way that I think you should. Referee, someone's going to step in here and manage and referee this family and try to kind of calm everything down. Or the witness, I don't need you to intervene, I just want you to see my injury so that I don't feel alone in this way. I don't think you want to be in any of these roles, and that was a great comment from someone in the front earlier on, that in family interactions, although there's all these poles, you really want to keep your professional boundaries. You want to be human, you want to be caring, you want to be your best self, but you want to be a fiduciary. You don't want to be a family member. I don't think you want to be a therapist either in this situation. So the goals are to learn the family cycle, not so easy to do, but to kind of map out what is the pattern of interaction, figure out what role you're being pulled into, and unhook. That's the sort of ambitious task that I think you all face, that I hope as I get to know more fiduciaries, there's a way that there can be consultation. It seems like there's some of this, but even more consultation among fiduciaries around just these questions. Okay, I want to move on to neuropsychological impairment with our last 10 minutes here. So neuropsychological impairment, that's deficits in functions such as memory, attention, planning, verbal capacities. It can coexist with high intelligence in certain domains. This is what's complicated about it. People can be very bright in a certain way. I mean, actually, I could be very cognitively impaired and you wouldn't know it by now. That's completely possible. That I, in this skill set, could be able to do this and could have some major deficits somewhere else that would maybe even make me incompetent in terms of testamentary capacity that just don't show up. So it's very hard to see when that's happening. Cognitive impairment is often mistaken for irritability, stubbornness, suspiciousness, and deceitfulness. So I just have some examples. An inability to sequence legal steps leads a client to become overwhelmed which can appear to be irritability. If you don't have that cognitive capacity to say, we're going to do this, then this, then this, you get overwhelmed and you get irritable, and it can look like the person's just kind of, just not nice when actually there's something cognitive happening. An inability to recall previous conversations due to a memory issue causes clients to believe that her fiduciary, attorney, or caregiver is tricking him. If you can't remember things, you get paranoid. It's just disorienting to navigate through life, let alone financial decisions without complete memory. Clients sometimes confabulate unintentionally for poor memory, which can look like lying. They just come up with things. And clients can be unable to switch sets, which look like being stubborn. People can get very stuck on a line of thought, and switching to another one can be difficult. I bet you guys are very good about that. We're going to hit this point, then this point, then this point. But they get stuck on this point and can't separate them. Cognitive impairment is not uniform. Individuals may be able to live independently, interact and joke in a socially appropriate manner, but still have significant memory impairment. And overlearned tasks are less subject to decline because people become creatures of habit. There's something about joking. People who think that people who can joke well aren't cognitively declined. You can be very humorous and sharp and still have real impairment. So the take-home point here for me is that you can't presume capacity unless you're assessing the specific capacities the person needs to have. You can't infer them from other capacities that happen organically in a conversation. And then I just want to briefly end with cognitive strategies relevant to improving testamentary capacity. There's not a lot of literature on this directly, but you can borrow from the literature on medical capacity, the capacity to make medical decisions. And what you can do is slow down, restate, and give a staged presentation. What that means is you give information very slowly, you restate it many times, and you don't move to the next step of information until the first one is learned. So I'm going to give you some information. You've got to find a way to do this that is respectful. That's the challenge. But say, can you tell me what you understood that I just said? And until you get that, you don't add the next piece. And then you say, can you tell me those 2 pieces of information? And then 3 pieces of information. So it's a staged presentation in that form. Question? Yeah.
How do you differentiate between the ability to repeat what you just said to your client and the evidence of comprehension?
That's a great question. So the question was, how do you differentiate between someone basically parroting what you said, which just takes very short-term memory, versus someone who actually is learning that information? And I think it takes some conversation. I also would always use the phrase, can you repeat what I said in your own words? And then I would ask a couple questions that would illuminate whether they understand that or not. So if you're talking about, who are the family members that are going to get some money from them after they pass away, for instance, I wouldn't just have them list the family member. I'd say, well, how do you think Aunt Annie's going to feel about that? And who is Aunt Annie going to be worried about getting more money than them? So once you get a little conversation, it becomes pretty clear pretty quickly. It's a great question. Thank you all so much for the opportunity to do this presentation. I really enjoyed this. It's a great group. Many insightful comments. I just want to let you know some things that I might be able to be of help with you. I do competency evaluations to make medical decisions, neuropsychological functioning evaluations, testamentary capacity evaluations, treatment and housing recommendations, conservatorship work, and then I'm also available just to consult on family dynamics and client control issues. Sometimes people will call me without me ever meeting the family and say, here's the situation I'm struggling, can you help me think this through? Can you identify the cycle of interaction? Anyway, I love interacting with fiduciaries and would love the opportunity to work with any of you. Last thing I'll say is if anyone wants to bring a card up, I do have an email list. I do some trainings in my office sometimes that are free that people are welcome to come to or present at different places. Sometimes send out articles. So if anyone wants to be on that list, give me your card and I'll plop you on that. Thank you very much.